Good evening, everyone. If you're eating, please continue. Go ahead and eat. I'm going to continue with the program while you are going to dinner. Please take the time, respect everyone's time this evening. I'm Holly Kine, I'm the Director of External Studies at the college, and I'm responsible for the experiential portion of our PharmD curriculum. So I actually want to welcome you to tonight's celebration. The college has a long-standing history of recognizing excellence in precepting for individuals who partner with us to administer 1/3 of the Doctor of Pharmacy program through experiential learning. We have acknowledged the Preceptor of the Year since 1986. Those preceptors were educators in rotations that occurred in the final year of pharmacy school, and what we now refer to as advanced pharmacy practice experiences, or as we affectionately call them, our APPEs. Over time, the college has expanded our experiential learning to include additional regional collaborations and experiences and earlier opportunities that are called our introductory pharmacy practice experiences, or IPPEs. To ensure that excellence in precepting was recognized across all of our experiential coursework, we expanded our single Preceptor of the Year awards in 2022 to the following categories: Advanced Pharmacy Practice Experience, Introductory Pharmacy Practice Experience, Commonwealth Experience Rotation, New Preceptor, Global Clinical Education Center, and Lifetime Achievement. So I would like to invite all of our previous UK College of Pharmacy Preceptors of the Year from 1986 to 2022 who are present this evening to please stand at this time. Before we recognize our 2023 inductees into the Hall of Distinguished Preceptors, I'd like to recognize a member of our experiential team. Mr. Mike Richardson is a program coordinator who is responsible for overseeing much of our logistical and operational aspects of our experiential program. It takes a small army, pun intended, to run this portion of the curriculum with over 700 preceptors, 250 individual sites, and nearly 500 student pharmacists. Mike began his role at the college in February of 1999 and will retire this December 31st, marking almost 25 years of service with the college at the end of this year. Mike came to us by way of a second career after retiring from the U.S. Army as Lieutenant Colonel in the Military Intelligence Branch after 26 years of service all over the world. Mike recalls that some of his favorite memories at the college include supporting all of our great preceptors and doing my small part in ensuring the success of the very high-quality students that attend UK College of Pharmacy. Now, Mike's work in military intelligence has certainly come in handy when we've had to track down a few students or preceptors who were MIA. And almost every preceptor who has been a part of the UK College of Pharmacy in the last 25 years has interacted with Mike Richardson in some way. So, Mike, would you stand and let us recognize you tonight? Thank you for your service, not only to our country, but to our country. Now on to our awards. Our 2023 Hall of Distinguished Preceptors are all initially nominated by student pharmacists who have completed experiential courses with these individuals. Additional criteria for excellence includes a dedication to preceptor development, willingness to provide multiple experiential opportunities, and evidence of quality from the student evaluations. Tonight, our first preceptor inductee receives the Advanced Pharmacy Practice Experience Award for Excellence in Precepting our Advanced Pharmacy Practice Experiences and is nominated by the Whiteboard graduating class. Dr. Natalie Walker grew up in Palm Harbor, Florida, and completed her undergraduate degree at the University of Miami. After relocating to Lexington, Kentucky, and working in human resources for 8 years, Dr. Walker decided to make a career change and graduated with a PharmD from the UK College of Pharmacy in 2014. Following graduation, Dr. Walker completed a pharmacy practice residency at the Lexington VA, which she continues to work today. One of Dr. Walker's nominating student pharmacists said this: Dr. Natalie Walker epitomizes what students hope to find in a preceptor. She excels in the educational component of her professional practice, explaining complex science with ease to learners and colleagues of all levels across many health professions. She takes great ownership of her work in a pharmacy practice in the facility Her investment in quality work shows in the structure of her API rotation and in the standards that she sets forth for students. As cliche as it may sound, Dr. Walker creates the sort of environment that UK College of Pharmacy and UK more broadly strive to create, where things are wildly possible. I will be a better pharmacist as a result of the time that I spent with her. Please join me in recognizing the 2023 Advanced Pharmacy Practice Experience Preceptor of the Year, Dr. Natalie Walker.
Thank you. Thanks so much. It's really exciting to be here and accept this on behalf of whoever that comment was about. I'm not sure who that was, but I appreciate it very much. As a fourth-year student preceptor, I definitely try to keep in my memory how I felt on my very first day of my very first API rotation, walking through a long hallway in the Lexington VA, as it may be. Wondering exactly who from the college thought I was ready for that experience at that moment in time. And it turns out I walked in and I met my first preceptor, Kelly Davis, for my acute care rotation, ironically enough. And she spent the next 6 weeks showing me the best patient population to work for in our veterans, and an institution who has really given pharmacists the opportunity to work at the top of their license for decades. And the most exciting form of pharmacy there is, and that's acute care. And I left that rotation thinking to myself, I think I want Kelly's job one day when I grow up, which was also ironic considering I was a 35-year-old non-traditional student in the middle of a career change. But I left that rotation also realizing that I had a good chance of leaving all of my rotations thinking that very same thing. I did not, luckily. However, I had the opportunity to work with some incredible preceptors along the way that taught me so much and really shaped the way my career turned out. So at the end of that year, I sort of found my home, and Matt Lane, who you'll hear from at some point tonight, went from being that pharmacist whose office was next to my preceptors, to my residency program director, to my boss when he offered me my first job as a pharmacist. About 5 years ago, he offered me my second job as a pharmacist, and it turns out that was Kelly Davis's job, the one I'd had my eye on for so long, as she moved on to create an antimicrobial stewardship program at our institution. So I was super excited about that, except she left some huge shoes to fill as a preceptor. So I embraced the challenge ahead and went for it. And thankfully haven't done too bad if people say things like that. But it's been a wild ride, and it's great to hear those things, but I really feel like I owe a lot to the students. I've made it a point to become a preceptor in my career, but it's really the students who give back so much to us. And I know a lot of you in the room feel the same way. They challenge us. They challenge us to stay on top of our game academically so we can be good teachers to them. They make sure our clinical knowledge is top notch. They humor me sometimes when I pull them aside and throw a wrench in their career plans and say, you know what, I know you haven't considered it, but acute care is a really good fit for you. And they've made me a feedback machine. And they've reminded me sometimes that feedback is really only feedback when you call it feedback and you give it often. So they've done a lot for me as a pharmacist in my career as well. So I really do appreciate those companies that they have. And I thank those of you here representing the college for trusting me with the students and helping their transition from the classroom to practice, because it's a super rewarding experience that I really didn't wrap my head around until I got the opportunity to do it. So thank you so much.
Congratulations, Dr. Walker. Our second inductee received the Introductory Pharmacy Practice Experience Award for Excellence in Precepting Introductory Pharmacy Practice Experiences, and nominated by PY1 through PY3 student pharmacists. Our IPI courses include both our summer 3-week immersion rotations and our longitudinal IPIs that are embedded throughout the semesters that we call our LEAP program, or Longitudinal Experiential Education in Pharmacy. Mr. John Serafini is a community pharmacist based in Lawrenceburg, Kentucky. He developed an interest in pharmacy from his grandfather and uncle, who owned and operated Serafini Drugs in his hometown of Frankfort, Kentucky. In 2014, Mr. Serafini opened an independent pharmacy in Lawrenceburg, where his family had resided since 1998. He felt connected to the community and wanted to bring a personal experience to the community members. Mr. Serafini has owned and operated Anderson Apothecary since 2014. As a community pharmacist, he feels extremely fortunate to offer personal quality care to his patients. Mr. Serafini's nominating student pharmacist said, "My preceptor worked tirelessly to ensure that I got the most out of my time with him. I would not have had as good of an experience with somebody less dedicated to the transference of knowledge to the next generation of the profession. He really took interest in my education, challenged me, and was invested in my teaching." Please join me in recognizing the 2023 Introductory Pharmacy Practice Experience Preceptor of the Year, Mr. John Serafini.
Hello, so this is not generally my comfort zone here, so I don't do this for accolades by any means, so. But it's very humbling, especially being voted on by the students. I think that's where our focus is. So it's also brought on, I guess selfishly, I could say I got into this to create contacts and network and that sort of thing with the young pharmacists. And as Natalie said, it's sure any preceptor would say they may motivate the students, motivate us to keep on top of things for sure, because it's easy to get lackadaisical about keeping up with current information. So that part's very beneficial to me, but it's good to see that hopefully I'm reaching a few. You know, as far as it led into a whole other scenario with my family, but I have a daughter that's has become getting ready to student 3rd year of pharmacy school. Met her now fiance is in a 4th year of pharmacy school, so I guess we're going to talk a lot about drugs at family dinners now. So anyway, but it's very humbling, and I'll carry it just forever. Thank you very much.
Right, so congratulations, Mr. Serafini. To introduce our next inductee, I would like to welcome Dr. Frank Romanelli, Associate Dean for Academic Affairs.
Thank you. You know you're getting old when you have to start giving awards to your former students. So before I read the formal background on Sandy, her family is deep in pharmacy. So I remember teaching her sister, Ivy, and Ivy was famous for having a lot of highlighters. And I remember she had all these pens. And I remember the first time I met Sandy, and she's like, "Well, I'm Ivy's sisters." And I'm like, "Do you have the same pen issues?" And Ivy does. She did not. And her husband, Mike, Dr. Mike Berger, is an alumnus as well. So her family has very deep roots in the College of Pharmacy. So our third inductee is for the Commonwealth Experience Rotation Award for Excellence in Precepting Student Pharmacists in rural or medically underserved areas or populations of the Commonwealth, as nominated by a Q4 student. Every UK student is required to complete a Commonwealth Experience Rotation with a goal of applying the college's curricular learning outcomes for medically underserved populations and communities, health disparities, culturally diverse populations, and rural health and patient care practice. Dr. Sandy Berger is a Henderson, Kentucky native who completed her undergraduate studies and PharmD at the UK College of Pharmacy in 2003. She spent most of her career at Owensboro Health Regional Hospital, where she currently serves as a supervisor in the surgery satellite pharmacy. Her surgery passion began during her API rotation with UK College of Pharmacy professor, Dr. Kenneth Record. She now oversees medical distribution and clinical issues in surgery, anesthesia, endoscopy, cath lab, recovery room, and prep and recovery areas. Dr. Berger has been a preceptor for the College of Pharmacy since 2009 and is a preceptor for the Owensboro Health PGY1 Pharmacy Residency Program. One of Dr. Berger's nominating student pharmacists said this: "Dr. Berger was an amazing teacher and provided a learning experience far beyond my expectations. Not only did she dedicate time to spend with me learning the surgical drugs, she also allowed me to observe other professionals to see how each drug was working in each patient and to tie together workflow involved around each and every patient. Dr. Berger is the best preceptor for any experience I've had throughout my entire educational career. Please join me in recognizing the 2023 Commonwealth Experience Vocational Preceptor of the Year, Dr. Cindy Berger.
I do have my speech on my phone. And this will make me feel older. I can't think of a better way to celebrate my 20th year of being a pharmacist. And it's hard to believe it's been 20 years. I'm honored to receive this recognition from the college. I tried to think back on how I started as a preceptor, and I realized I owe part of this to my husband, who has helped set up the Owensboro CEC back in 2008. I remember being super excited to show my little niche in the surgery satellite. I created my syllabus and my lesson plans, including reading 33 pages in Coda Kimball, because I'm old school, in my journal article collection. I had this binder that I have all of the students look through, and it's actually getting so old, it's held up by duct tape and prescription tape. I knew the only way I really understood the surgery medications was to also see them in action. So I was set on allowing students to directly observe them in use and shadow anesthesia, nurses, and surgeons to fully understand the team. So not only do the students learn the distributive role and clinical role of the satellite pharmacy, but also being part of the team and learning all the different perspectives. So again, I'm honored to receive this recognition to realize that maybe I did have a part in student education. They definitely helped me learn more in my own career throughout all these years. And I've made some lifelong friendships with many of them. I only wished I could work with all 40 to 50 of them directly still. I try to recruit them all the time for our residency. I work with a few of them, so I'm really grateful for that. And they've all amazing every year, and I've literally cried at the end of the 6 weeks when they have to leave me. And I'm so proud of all their accomplishments. I think most of the ones I had this year, they'll match with their residencies. Some have already told me where they're working, so I'm excited for all of them. Thank you to my family as well for supporting me, especially Mike, who didn't want me to call him out. But really, I wouldn't have been so involved without him and helping me write my syllabus, even for the residency program. I need to thank Owensboro Health. All their support in our pharmacy anesthesia. Without them, they wouldn't be able to show all those drugs in action. The surgery department at Owensboro Health has been really supportive as well, always allowing the students to go wherever, shadow surgeons, perfusionists, everyone. So without all of them, this would not be the rotation. So I really appreciate the recognition. I can't believe it. Thank you so much.
Congratulations, Dr. Berger. To introduce the next inductee, I would like to welcome Dr. Janet Mills, Assistant Professor, Global Clinical Education Center Coordinator, and member of our experiential faculty. I'm getting old, I have to put my glasses on. Our fourth inductee receives the Christopher Miller Louisville Clinical Education Center Award for Excellence in Precepting Avid Students nominated by students in the Louisville Clinical Education Center, also known as the Louisville CEC. Since 2006, UK College of Pharmacy has partnered with Norton Healthcare to establish this regional CEC to expand pharmacy experiential learning opportunities for student pharmacists who would like to complete their API rotation in the Louisville area in their PY4 year. A UK College of Pharmacy faculty member serves as the clinical training coordinator based at Norton Healthcare in Louisville. The first coordinator, Dr. Christopher Miller, was instrumental in establishing the CEC and developing a robust experiential program in this region that over 250 students have now completed. Dr. Philip Hutchinson grew up in Flatwoods, Kentucky. He attended UK College of Pharmacy, earning his Doctor of Pharmacy degree in 2011. He completed a pharmacy practice residency at St. Clair Regional Medical Center in Moorhead, Kentucky in 2012,
and is a board certified pharmacotherapy specialist through the Board of Pharmacy Specialties. Dr. Hutchinson continued to work at St. Clair Regional Medical Center, precepting PGY1 residents and pharmacy students for multiple pharmacy colleges. In 2015, he accepted a clinical pharmacist role at Norton Brownsboro Hospital in Louisville, Kentucky. One of Dr. Hutchinson's nominating student pharmacists said this: "Dr. Hutchinson is a great preceptor. He is very knowledgeable and genuinely cares about his students and their learning. He always creates a relaxed and lighthearted environment while keeping the patient as the number one focus. I have never learned so much in a day while laughing frequently along the way." Please join me in recognizing the 2023 Christopher Miller Louisville CEC Preceptor of the Year, Dr. Philip Hutchinson.
I want to thank the students of the Louisville CEC for nominating me for this. It's pretty flattering to get any kind of award. I was lucky as a student and a resident to have a strong collection of preceptors and mentors to kind of provide a template for my own precepting practice through the years. It showed me the importance of not only teaching the students, but also preparing them for independence in their professional life after graduation. That helped me kind of focus on providing a positive example for the current students to refer back to when they begin their own precepting careers and having their own students in the future. With the goal of providing an experience a student can use as a building block to creating their own practice as a preceptor, no matter their place in the healthcare landscape. It's kind of important for me to kind of realize that these students now, in less than a year, will be individuals that will be not only peers, but also representing the career that I have chosen in pharmacy. At the end of their time with me, I really hope I'm able to give the students the confidence they need to transition to an independent professional life. Thank you to the students of Louisville CEC.
And I should have put these notes in the script, but our own very Dr. Chris Miller is here with us tonight. So Chris, you'll stand. We are thankful for your service to the Louisville community. And again, congratulations, Dr. Hutchinson. To introduce our next inductee, I would like to welcome Dr. Melanie Ryan, Professor and Assistant Provost for Global Health Initiatives.
So our fifth and final inductee for 2023 to the Hall of Distinguished Preceptors will receive the Lifetime Achievement in Precepting Award. This award recognizes the preceptor with over 20 years of precepting experience with the UK College of Pharmacy. Nominations come from current and former students, alumni, and the experiential team. Dr. Matthew Lane is a board-certified pharmacotherapy specialist and chief pharmacy officer at the Lexington VA Medical Center. He received his Bachelor of Science in Pharmacy from the University of Kansas, and his Doctor of Pharmacy from UK College of Pharmacy. He completed his pharmacy practice residency and critical care residency at the University of Kentucky Medical Center. And on a personal note, Dr. Lane and I were in the same PharmD class. I vividly remember receiving a list of about 25 rotation sites in 1992 and poring over it and trying to decide what would be our top choices. Matt, who would have thought in 2023 there were hundreds of rotation sites, and out of over 700 preceptors that you would receive this award. So after working at the Ochsner Medical Center in New Orleans, he returned to Kentucky and joined the Lexington VA Medical Center as a clinical pharmacist and a faculty member at the UK College of Pharmacy. Dr. Lane has been involved in the didactic program and precepting pharmacy students for over 30 years. He earned multiple promotions during his tenure at the VA, initially as the surgery critical care clinical specialist, and he provided clinical services to surgery, various acute care areas, primary care, anticoagulation, dialysis, and vaccination clinics at the VA. He served as residency director for 25 years and was eventually promoted to clinical coordinator and most recently chief of pharmacy. Throughout his time, has been involved in expanding clinical pharmacy services from 5 pharmacists to over 27 finally. Dr. Lane has precepted over 400, I'll say that again, 400 pharmacy students during active and leave rotations and 58 pharmacy residents at the VA. He values the opportunity to help trainees advance their clinical knowledge and growth, and his most satisfying role is learning from his students and seeing them prosper in their careers and in life. Not only has he personally precepted all of these hundreds of students on introductory and advanced pharmacy experiences, but he's also an advocate and a leader for experiential learning. When we began expanding the IPs to include the LEAP component, he fully adopted the concept and recruited additional preceptors for that mission. One of Dr. Lane's nominating student pharmacists acknowledged his dedication to experiential learning and said this: Dr. Lane had a personal family matter to attend to, but before he left to attend to his family, he made sure I was set up on my rotation for the next few days. Even on such a difficult day for him, he spent the morning showing me the hands-on process of setting up a dialysis session for a patient and discussing the important factors to consider in that process before leaving for the rest of the day. I greatly appreciated that gesture, even though he had much greater things on his plate. Throughout the rest of the rotation, Dr. Lane demonstrated in the same fashion that he too valued my education. So please join me in recognizing the 2023 Lifetime Achievement in Precepting Award, Dr. Matthew Lane.
Thank you, everybody. I'm really deeply honored. Ever since I came, pretty much since Kentucky for pharmacy school, I've always been interested in helping others and working with other students and classmates and even the residents that I was working underneath. And I had some outstanding mentors. Mary Chandler helped me a lot, and Clifton helped me a lot. Helped me to kind of look at career options that went way beyond what I thought of as traditional pharmacy roles. And the best part about that is that it gave me the opportunities to continue to help with mentorship of other upcoming pharmacists. By the time I finally ended up at the VA, I quickly realized that even though my background, I really loved the university setting, but the VA was such an outstanding place for us to offer training opportunities. And as Natalie said, I totally agree that it's a great place for us to function as pharmacists, but it's also a great place for us to also mentor. And so, I've always been trying to do my best to expand our services as well as give great opportunities for people. And so, really thankful for having all the opportunities to have as many students as we've had, to develop our residency program, to also see that and kind of see where people go. A lot of our trainees end up working for us. Adrian worked for us, Natalie worked for us, Melody even did some fun work with us as well. So it's been really a great honor. I also really appreciate being able to collaborate with Mike. He was really helpful in trying to help us deal with all the students that come over to the VA. I work for the federal government. And I don't know if you know about that group, but we're difficult to work with. So Mike's helped us to kind of facilitate the best we can to, similar the students in our culture. And it's been really good. So I guess I get to retire since it's a lifetime achievement. I don't know what I'm done, but I'm really thankful. I appreciate everybody's encouragement for me.
Good evening, everyone. I'm here to introduce today Dr. Art Brazil. He is a highly accomplished senior ophthalmic pharmaceutical executive with a proven track record of success in research and development, commercial management, and business development. Under the direction of Harry Kostenbader, he was the first BS in pharmacy graduate in 1975 to obtain his PhD in pharmaceutical sciences in 1980 from the college. Over a career span of more than 40 years, Dr. Brazell has made remarkable contributions to the field of ophthalmology drug therapy, leading to the development of innovative drug delivery approaches and enabling the treatment of back of the eye diseases. He currently serves as head of R&D and chief medical officer for Power Pharmaceuticals. He has played a crucial role in clinical R&D, including designing unique study protocols and analyzing data to assess drug safety and efficacy. Dr. Brazell's efforts have resulted in the approval of 7 new drug applications, an exceptional achievement given the high attrition rate, very high attrition rate of research drugs. In addition to his pharmaceutical expertise, Dr. Brazell has also led executive management teams in strategic oversight, mergers, and budgeting. His business acumen has significantly impacted increasing revenue, drug product development, licensing decisions, and regulatory approvals for the companies he has worked with. Dr. Brazell's career highlights include executive management of global R&D departments in large and small ophthalmic pharmaceutical companies, leading the development and approval of several commercially successful ophthalmic pharmaceutical products in multiple disease areas, and successfully managing the Inspire Ophthalmology business unit, achieving more than $90 million in revenue. He has also played a key role in successful mergers and acquisitions, including representing Inspire in its $430 million acquisition by Merck. Dr. Brazell has served as a sponsor, moderator, and presenter at a successful FDA advisory committee meeting, demonstrating his expertise in medical affairs. His contributions to ophthalmology have been recognized nationally, and he's highly sought after for his evaluation of new drugs and clinical trial design. His reputation as an expert in the ophthalmic pharmaceutical industry has made him an outstanding consultant for clinicians and researchers. His success and dedication to the field make him an excellent role model for the next generation of both pharmacists and scientists. Dr. Ed Holland, one of the world's leaders in corneal surgery, expressed his high regard of Dr. Brazell's in his nomination by stating, as head of R&D and chief medical officer, Dr. Brazell and his team achieved FDA approval for 2 ophthalmic drugs. One of these drugs, Usubis, was approved for the treatment of dry eye. To put this in perspective, there are only 2 other pharmaceuticals approved in the US for the treatment of dry eye. Well over 30 clinical trials in the last 2 decades have tried to achieve FDA approval for dry eye and failed. Dr. Brazell's trial design and selection of unique clinical signs and symptoms in conjunction with an excellent medication has resulted in what many clinicians believe will be the best treatment for dry eye, a condition that affects over 30 million patients in the US alone. Please join me in recognizing the 2023 Alumni Lifetime Achievement Award recipient, Dr. R. Ken Brazell.
Thank you. I'd like to thank the college and everybody involved for this award and this wonderful night. It'll be something I'll always remember. When I first heard from Kip that I'd gotten the award, I spent a good deal of time reflecting on my years at the college. Total of about 9 years, I believe, and thought a lot about the impact it had on me and about the people that helped me along the way. As was said, I was the first undergraduate at the College of Pharmacy, the only graduate school, so I thought I'd share with you a little bit of that journey, and particularly the mentors I had that really helped me along the way. I grew up in a small town in extreme western Kentucky with about 1,500 people. About as far as you can get. I worked in a pharmacy in high school, which I think many of us that went into pharmacy did. I learned a lot about pharmacy, particularly about the role it had in small communities and rural communities, and that's followed me throughout. So when I came as an undergraduate to UK, I realized we had to declare a major. I didn't really know that. I was kind of a country boy, so I said, how about pharmacy? I said, okay. So they assigned me Professor Doty. Some of you may have remembered Professor Doty. He was my advisor, and he helped me work out my schedule. He actually told me what my schedule was going to be. And he told me, what it was going to take to get into pharmacy school and some of the steps I need to take. Well, it turned out I wasn't a very good student those first couple of years as an undergraduate, so I applied the end of my second year and unfortunately didn't get accepted the first time. And so I came back to UK that fall and took a mishmash of classes trying to figure out what to do next. And second or third day of classes, Professor Doty tracked me down in one of my classes and said, we've had somebody drop out. You're up first on the waiting list. Would you like to join? And I was a little stunned. I said, sure. And he kind of looked me over and said, go home and put on some nicer clothes. It was the 70s, and come see me. And so I went to his office that afternoon, and after we worked out, all the details and got me enrolled. I remember the last thing he said to me that day. He looked me in the eye and said, remember, you were the last one in. And I was a bit taken aback. I didn't quite understand. I thought he was taking a shot at me. But I came to realize that what he was saying is this isn't going to be easy. And you're going to have to be a hell of a lot better student going forward than you were in the past. And I did carry that with me and did get a little bit better. But I did get into pharmacy school. There were two people during my days at pharmacy that had a significant impact on my life. These were the two mentors, and what they did is really carried through even to today. The first was Paul Parker, which I think many of you perhaps knew or have heard of. He was a professor in clinical pharmacy. He was a pioneer in clinical and hospital pharmacy. There's an award named after Paul. I think Henry won that award a few years ago. And he was a great person. And the other was Harry Kostenbacher, who was my thesis advisor. He's had a significant impact on me as well and remained a friend lifelong until he passed away about 10 years ago. I first met Paul Parker my first semester of pharmacy school. He taught a class on pharmacy orientation. He talked about the history of pharmacy, the role it played in medicine, the role it played in society. And I found myself, for some reason, being on the second row right in front of him. It was the next semester. I figured out he wanted to be about 3/4 of the way up, as far away from the professor as he could. But one of the things Paul liked to talk about was the role that pharmacy played in small towns and rural communities. And that's something that I was very attuned to. And so we engaged in a number of conversations during class. And it was very enjoyable. We developed a bit of a friendship. And fast forward a year and a half, Professor Doty did have an impact on me. I found that I got asked to join ROCI, which is the honorary society. I was very honored with that. And I went to the ROCI banquet and ended up sitting at the same table as Paul. And we started talking, and after saying more than once how surprised he was that I got into ROCI, he asked me, what are you going to do? What's your career? And I told him that I decided to go to graduate school, probably in pharmacology, and I reached out to Ohio State. I think I reached out to Michigan. And those who know Paul, he's like, that's stupid. You would be stupid not to consider going to UK graduate program. And he said, come see me, make an appointment to come see me. So I went and started talking to Paul. We had a number of meetings. He started lobbying me to join the graduate program at UK. And also I saw what he had in the back of his mind. He was also lobbying me to also do a R&D residency. At the same time, he had a vision of a clinical scientist role where you took science part and clinical part and kind of integrated those together. It was sort of before its time. Today we call that translation of medicine. The second meeting, he said, listen, I took the liberty of getting you an internship with Tom Foster over in the hospital. and getting you a summer job with Dr. Costa. So I did a nice project with Tom in the hospital. We was on titration of phenytoin dosing and head trauma patient using blood levels. So I learned a lot from that. Tried my best to keep up with Tom. He was always on the go. And then the summer job at Dr. K, we finally called Harry Costabatter Dr. K in his lab. I learned my way around the lab. I learned a lot about what graduate school is all about. I helped a number of the graduate students with their thesis projects. I didn't blow anything up. And I learned a great deal from Dr. K. And at the end of the summer, he said, if you'd like to go to graduate school, there's a spot here for you. And I would be happy to be your advisor. So that's sort of, that made the decision for me. And I ended pharmacies. I joined the graduate program after I graduated in the 5th year. Spent four and a half, seems like forever, great years there. I learned a lot from Dr. K and continued to talk to Paul. And Paul was lobbying me. Okay, you're going to get your PhD, then you're going to go into the pharmacy, into the pharmacy residency program. You're going to do something nobody's ever done. He even got me a job working on the weekends in the drug product evaluation unit. They did all the drug studies in the hospital, pharmacokinetic bioavailability studies. And Jim Bustrack, which Henry, you may have remembered, and I basically ran those studies. Our job was to keep Tom out of the way. I learned a lot there. I considered the R&D program, but after 4.5 years of graduate school and 10 years of living like a pauper, I decided it's time to go out in the real world and started what to me has been a very rewarding career in the pharmaceutical industry. I'd be remiss not to mention the friendships and the colleagues I met along the way. We had a very tight, close-knit graduate student group with Phil Mayer, who nominated me for this award, Mike J., Mark Gillespie, and others, all of which were previous award winners for this award. And I've kept up with most of them over the years, and they still remain friends. I made a lot of good friends in undergraduate school. One of them is here, Gene Thompson. We were roommates together until he left me for his wife, Ann. But he did leave me his 200-pound St. Bernard. And Gene, we've stayed lifelong friends. And a few years ago, Gene did something that changed my life forever. After we sold our last company to Merck, decided to move back to Lexington. I was single, bought a place down here in Short Street. So thanks for having it here. And after settling in for a couple of years, Gene decided to try his hand at matchmaking. And he introduced me or reintroduced me to who's now my wife, Vicki. And I remembered Vicki well because she was an undergraduate when I was in graduate school, and I was a TA in a couple of her labs. So I was sort of her teacher. I was a bit smitten with her, if you understand why. But she was gonna get married or something, so it didn't work out. And in addition to that, in those days, a graduate student would never go out with an undergraduate. That's an inside joke. For those that don't know. But we dated, and 5.5, 6 years ago got married. So truly a pharmacy alumni family. Again, a great example, I think, of the significant impact that the college has had on my life. So I'd like to close, just say a few words about mentorship. I think you would surmise from what I've said tonight how important mentors have been in my life. The two I had in the College of Pharmacy really impacted me in ways that I can't really quantify. And I was very lucky to have them in my life. But there are a lot of young people out there today that don't have that, that don't have the role model, don't have someone who can provide them guidance, give them advice, open doors for them. So any of you out there that aren't a mentor today, go out and try to find someone like that. Because a lot of times these people are stuck or they don't know how to get going in the right direction. And all they need is somebody to reach out, provide them some advice, help open the doors. And you can have a significant impact on people's lives, as my mentors did. And in my experience, it'll be a significant impact on your life as well. So again, I want to thank everybody, and it's really an honor and a pleasure, and hope you enjoy the rest of the evening.
Good evening. My name is Craig Martin. I'm Associate Dean and Chief Operating Officer at College of Pharmacy. I just tried to get my new best friend to come up here with me, but I want to take a minute. I'm looking around at other tables. You guys look like you have some fine tables, but none of you are like table 3. My new best friend is Miles Mann at table 3. Can we give him a round of applause? I met Miles just a bit ago, but it feels like I've known him forever. He is 5.5 years old. We wanted to make sure that we knew that the half was in there. So it's actually been the entire Mann family. It's been great having dinner over there. So sorry for going off script, but I just wanted to make sure that the Mann family felt welcome. So it's really my pleasure to be able to introduce Dr. Henry Mann. Dr. Mann's been Dean and Professor at the Ohio State University College of Pharmacy since 2013. Previously, Dr. Mann was Dean at the University of Toronto, where he directed the implementation of the first English language entry to practice PharmD program in Canada. Going through that, it doesn't feel like English is my first language there. While Dean at the University of Toronto, he also served as the Association of Faculties of Pharmacy of Canada, as Chair of the Council of Deans, as Vice President of the Association, and as a member of the Board of Directors, in addition to being a member of the Council of Deans. Dr. Mann received his BS in Pharmacy in 1976 and his PharmD in 1980 from the University of Kentucky, where he completed a residency as R89 under the previously mentioned Dr. Paul Parker. Dr. Mann then rose through the faculty ranks at the University of Minnesota from 1980 to 2009, where he also served as Associate Department Head for Pharmacy Practice, Associate Dean for Professional and External Relations, and Associate Dean for Clinical Affairs. He was founding director of the Interdisciplinary Center for Excellence in Critical Care at the University of Minnesota and the National Research Network Partnership for Excellence in Critical Care. Dr. Mann has presented and published widely on applying pharmacology and pharmacotherapy principles to critically ill patients. His contributions to research and practice have been recognized by election as a fellow of the American Society of Critical Care Medicine, the American College of Clinical Pharmacy, and the American Society of Health System Pharmacists. He received the Research Award of the ASHP Research and Education Foundation and the Technology Enhanced Learning Award from the University of Minnesota. Dean Mann also received the University of Minnesota Pharmacy Alumni Society Faculty Recognition Award and the Weaver Medal for outstanding contributions to the college. The University of Kentucky selected him to receive the Paul F. Parker Award, which is given to recognize a former resident of their program who has made outstanding contributions to the practice of pharmacy. In 2013, he was also selected to provide the inaugural Thomas S. Foster Lecture at the University of Kentucky and received the National Rokai Lecture Award at the Rokai Annual Meeting in 2021. Dr. Robert Kuhn, professor and close friend of Dr. Mann, said, "There are few people in this world who possess the talent, dedication, and unwavering commitment to excellence that Henry embodies. As a clinician, he is gifted beyond measure with an ability to connect with patients in a way that truly makes a difference in their lives. And as a teacher, he has inspired countless students to follow in his footsteps and strive for greatness. But perhaps what is most remarkable about him is not just his individual achievements, but the way in which he has used his talents to become an academic leader blazing a trail for others to follow. Those of us who have had the privilege of knowing him over the years are in awe of his accomplishments and are proud to call him a colleague, a mentor, and friend. His years here at UK were nothing short of extraordinary, and we know that he has changed lives and made a real difference in the world. We will feel those effects for many years to come. Please join me in recognizing the 2023 Alumni Lifetime Achievement Award recipient, Dr. Henry J. May.
Thank you so much for that generous introduction. Great. You wrote it just, or you said it just like I wrote it. It was great. I'm very happy to have my brother George, his wife Cheryl, my daughter-in-law Barrett, and my grandson Miles with me today. I'm sorry my sons Mike and Marcus couldn't make it, as well as Betty, but that just couldn't work out. Get everybody in one place, even if it's Lexington, Kentucky. Kim, you were extraordinary. Thank you. Everybody forget what Kim said, because that's going to make it too hard for me if you compare it back. But I remember Kim as a graduate student while I was in my PharmD residency, and he was fantastic. Thank you. I am so happy to have this opportunity to express my gratitude for all Kentucky has given me, and to briefly reflect back over some key points of my pharmacy life that were influenced by my time here. I owe much of my career and the many wonderful things that have happened to me during the last 51 years to the University of Kentucky and this great College of Pharmacy. When I started at University of Kentucky, it was possible to finish my BS degree in 4.5 years. You took the summer semester, which I did. So I graduated December of 1976. That causes all kinds of problems with the Alumni Association, as you can imagine. During that summer of 1976, I completed my clinical clerkship at the UK Medical Center, working with Paul Parker. It was an eye-opening experience to be incorporated into the direct care of patients. That summer clinical clerkship was also a life-changing point for me. It was the time my real passion for pharmacy and what the pharmacist can do in healthcare took hold. I recognize that many of you are preceptors, and I cannot express how important you are in helping students adjust to the change from student life to patient care practitioner. My preceptors were PharmD residents. Particularly, I worked under a third-year PharmD named Jim Cloyd in a medicine rotation. I was amazed at how much these PharmD residents knew about patient care. They showed a level of commitment and excitement for taking care of patients that was simply contagious. And I think that's what all preceptors try to be, an inspiration to the students that they're taking. This was a defining characteristic for the 3-year PharmD residency program at Kentucky. Schools across the United States were hiring the graduates of this program to initiate similar programs at their universities. In the fall semester of 1976, I completed a hospital and a community externship in Moorhead, Kentucky, and the surrounding communities. There I met Dr. Bruce McQuinney, who was the AHEC coordinator for that area. I shared with Bruce how much I enjoyed the clinical experience, and he encouraged me to apply to the PharmD residency program. I was thrilled and a bit intimidated to be admitted to the class of 1980, and I got my residency number, R89. It may be a surprise to you, but those residents who did the combined program like I did, and that program ended in 1981, still get together on Zoom and talk about the program, the wonderful preceptors, mentors, and change agents they met that worked within the program. Clearly, I was not the only person to have my life changed through the little experiment in clinical pharmacy education that Paul Parker, the director of pharmacy at the medical center, had devised. I am now very conscious of how much we owe to these outstanding pharmacists who went before us. They helped establish what it meant to be a PharmD. And as they left Kentucky and went to other universities, they set the standards that have led us to the many great practitioners of pharmacy we have across the country. Think about that. This little school, that small program, changed pharmacy across all of the United States. I've had many mentors in pharmacy, but the people I remember most from Kentucky are always Amerson, Foster, Rapp, Pecoro, Parker, Record, and Bluen. They set a standard for me and most of the first 100 PharmD residents that came from this storied program. A usual class at that time was about 10 new students, and there were 3 classes at any given time. So about 30 residents were constantly looking for attention from these faculty. Due to the layered learning model we use, you quickly learn to ask for help and guidance from the senior resident, and also you became willing and able to provide help to those who came after you. I am sure the clinical faculty could not have dreamed of the impact they would have on the profession over the next 40 years from when I first met them. Back then, they were busily running their day, trying to keep up with patients and the students they were assigned to, using paper charts and white index cards, wondering if they would end up responding to a code 500 arrest situation where every bit of adrenaline in your body would be pumping at super speed through your veins. And this was just the average day. These faculty were the individuals who developed long-term relationships with their medical colleagues that allowed pharmacy to continue growing here. These partnerships allowed Kentucky to remain a national leader as our profession transitioned pharmacy education to the entry-level PharmD degree and postdoc residencies, both general and specialty. I also want to acknowledge that there was a remarkable succession of outstanding deans and pharmacy directors at Kentucky over the last 40+ years. Dean Kip Guy is a wonderful example of leadership that comes out of the bases, covers all of the bases: research, teaching, practice, and service. I've had the pleasure of working alongside Kip as a colleague dean, and I know the legacy of this great program has continued to grow under your guidance. Please join me in a round of applause for Dean Guy. When I graduated in 1980, I took a position developing surgery and later critical care services at the University of Minnesota, teaching and conducting research at the College of Pharmacy. I modeled my practice, teaching, research, and service activities after my mentors at Kentucky. I was lucky to have 3 Kentucky colleagues on the faculty with me at Minnesota: Jim Floyd, Sal Payne-Corvo, and Dan Canifax. Due to our shared experience at Kentucky, many of the thoughts on what clinical practice was and how to be a faculty member were common among us. As I worked up through the ranks at Minnesota, my Kentucky experiences remained, and I am sure they affected how we did things at Minnesota in many ways over the years. What we didn't have at Minnesota was the strong integration between the college faculty and their pharmacy leadership roles in the medical center. I saw the lost opportunities that were due to our structures and lack of strategic planning together. I also saw problems with how we failed to recognize faculty effort and the true time commitment it took to be both a faculty member and a clinical specialist, seeing patients essentially 12 months a year, 5 days a week or more. It seems to me that my mentors just did whatever it took, and I think the residents followed that model. The one thing I didn't really learn to do very well at Kentucky was to say no. When asked if I would do something, I was constantly overcommitting myself. But the good side of that is you get a lot done. I was an associate department head, associate dean, center director, and research network director over the 29 years I spent at Minnesota. I was constantly advocating for what pharmacy could do, and this became a theme for me. Pharmacy has a bigger role to play in healthcare delivery. How do we make that happen? That's a question I ask every day up until now. In 2009, I got a unique opportunity to advance clinical pharmacy practice on a large scale. The University of Toronto wanted to develop the first and largest entry-level PharmD program in Canada. The trouble was a whole lot of people and groups did not want this to happen. Toronto went searching for a new dean to lead this major change, and I was selected. I realized the impact on pharmacy's role in the Canadian healthcare would significantly change if the transition in degree could happen. Over the next 4 years, my colleagues and my college in Toronto worked very hard to get the PharmD degree recognized as an entry-level program. And we started the coursework and rotation that would be necessary for a PharmD program with 240 students per year. Most importantly, we also convinced the Association of Faculties of Pharmacy in Canada to support all of the other 9 schools adopting the entry-level PharmD degree by 2020. And all of this has come about. Since 2015, when the first students of the PharmD program from Toronto graduated, there have now been approximately 2,000 PharmDs trained through the University of Toronto program alone. When I moved to Toronto in 2009, the whole province of Ontario had only 750 PharmD trained practitioners. I take some pride in my work at Toronto and the impact it has had on practice. I also recognize the heritage of these practice models to those practiced for so long at Kentucky. Thank you, Preceptors. You're the ones that continue to make those meaningful practice models. I have spent the last 10 years as dean at the Ohio State University. I feel that much has been accomplished during that time, and I am proud of my work there. We have developed new faculty models that I think will bring important advances to pharmacy in the future. I frequently think back to when I was a part of the Kentucky program, and I still see links to practice, service, teaching, and research that has survived over 4 decades. My appreciation of being recognized by my alma mater cannot be overstated. I love having been a small part of the Kentucky College of Pharmacy. And I will always be proud to be a Kentucky Wildcat. Thank you.
I'll take that. I made sure I didn't get it off the table because I was afraid I was going to drop it. So,
Thank you, great.
That brings us to the end of our evening. So let me first just start by saying congratulations to all your awardees tonight, all well deserved. Enjoy it. Take it for what it is, which is a profound gratitude from our college for what you have achieved and a very strong happiness that you're part of our community. So when we talk about the college, we often talk about rigor and achievement and leadership and advancement. It struck me as I was listening tonight that there's a piece about this college that truly is special that we rarely talk about, and that is a sense of humor and a love for this place that persists over decades, and a sense of humility about what you've done and how you couldn't have done it without the community. I've been at another college that I shall not name at this level, and I can tell you, I don't say those things about that place. And I've really come to appreciate just how strong Kentucky is because we view ourselves as a unique community. We hold on to the people that are here, people who grow up here, want to come back and participate over and over and over again. To treasure that, I think we saw every person who spoke tonight exemplify those parts of being from Kentucky, in addition to being a rigorous and leading and practice advancing place to be. So again, congratulations to everybody for your awards tonight. I hope you've had a good evening, and that will end the program. If you're an award winner, I will ask you to come out afterwards for some group photos. And thank you, everybody, for joining us. And Henry, I think we might be on this too. Where do you want to go first?
There. In the rotunda, that corner right there.
Thank you, everyone.